Is my scene safe?
Your scene is safe. You were dispatched to take care of a 25-year-old male patient with difficulty breathing.
According to my dispatcher information, the nature of the illness is difficulty breathing of a 25-year-old male patient. Is this my only patient?
This is your only patient.
Now I will request backup, ALS backup.
ALS backup on their way.
I will consider C-spine, but due to the illness, I don't think it's necessary. So I will go ahead and give my first impression. My general impression of my patient is a 25-year-old male sitting in a tripod position, having difficulty breathing. And now we'll go ahead, and he's conscious. Now we'll go ahead and introduce myself. Hi, my name is Wendy from ENT. What's your name?
My name is Eddie.
Hi, Eddie. What is the reason of your call today?
I'm having difficulty breathing.
Okay. My patient chief complaint is difficulty breathing. Now I will go ahead and move to my ABCs. Before I will say that my patient is conscious and talking to me accordingly and properly, so I will give him an A for consciousness and alertness. Now we'll go ahead and assess the lungs because my patient was complaining about difficulty breathing. Okay, can you breathe in and out? I will assess my patient lungs from the top to the bottom, going side to side and going down. Now to the back, same way. What are my patient's lung sound?
Wheezy and bilateral.
Okay, since my patient lung sounds are wheezing and bilateral, I will go ahead and administrate 15 liters per minute, administrate oxygen at 15 liters per minute with a non-rebreathable mask. And we'll go ahead, the mask. And now we'll check the respiration rate. Respiration rate?
24 breaths per minute.
Now we'll go ahead and move to the circulation. What is the heart rate?
90 beats per minute.
Okay, I will ask, is there any major bleeding?
No signs of major bleedings.
I will go ahead and assess the skin. The skin feels warm and dry, a little bit pale. Is there any signs of sinuses?
No signs of sinuses.
Okay, now I will go ahead and now we'll make my patient a priority and transport in code 3. I will move on to my history, my OPQRS history. We'll take some notes. Okay, Eddie. What were you doing when you started feeling this way?
I was moving some furniture around.
Okay, can you think of something that makes it better or worse?
When I sit down, it makes it a lot better.
Okay, sitting down makes it better. Okay. How does it feel? Can you describe the pain, the difficulty breathing?
I'm having a tightness in my chest. It just feels like a tight squeeze.
Okay. Squeeze?
Like a squeeze.
Okay. Where's your pain again?
My pain's in the center of my chest, like around this area.
Does it move somewhere?
No, it doesn't move anywhere.
Okay. Doesn't move. Okay, from 0 to 10 being 0 being no pain at all, and 10 being the worst pain ever. What levels would you consider your pain?
I would consider my pain an 8.
And what about your breathing?
My breathing is shallow, but the pain scale would be an 8.
When did you start feeling this way?
I started feeling this way about 45 minutes ago.
I'm done with my OPQRS-T, so I will go ahead and move to my sample. So do you have any allergies?
I am actually allergic to some penicillin.
Are you taking any medications?
Medications right now, I'm taking albuterol.
Do you have any past history?
Past history.
Medical history, I'm sorry.
Medical history, yeah. I do have asthma.
Well, when was the last time you ate something?
Last time I ate something was breakfast earlier this morning.
So like 12 hours ago.
Yes.
What were you doing again?
I was moving some furniture because I wanted to remodel my house.
Okay, now I will go ahead and move to my secondary assessment. I think my patient is having pulmonary problems, so I will go ahead and reassess the lungs, and I want to hear my patient lung sounds again and see if the oxygen is working. So breathe in and breathe out. And back. Is the oxygen helping?
Yes, but lungs sounds are still wheezing.
Okay, so I'm still waiting. Now I will go ahead and check the vital signs. What is the heart rate?
Pulse 72 beats per minute.
Respiration rate?
18 per minute.
And the blood pressure?
110 over 70.
Okay. Now, my state feeling pressure on my patient is a 25-year-old male having difficulty breathing. I think he might be having a asthma attack, so I administrate him my procedure for administrating oxygen at 50 liters per minute with a non-rebreathable mask, and I will be assessing my vital signs every 5 to 10 minutes until ALS arrives.
ALS backup has arrived.
Okay. Now I will give my ALS the report. I have a 25-year-old male patient who is complaining of difficulty breathing. He was moving furniture when he started feeling this way, and then he went and sit down and started feeling better. He has a tight chest and squeeze. The pain doesn't move anywhere. The pain level is 8, and the breathing as well. He started feeling this way 45 minutes ago and has no allergies, has penicillin allergies. He's currently taking albuterol and the past medical history of asthma, and the last intake was breakfast. I assist him with taking the albuterol and the vital signs and oxygen, administered oxygen at 50 liters per minute with a non-breathable mask, and the vital signs are heart rate 72 per minute, respiration rate 18 per minute, and the blood pressure is 110 over 70, and he is ready to be transported. And this concludes my skill. That's it.
Okay.